Hi, welcome everyone. Welcome to the latest episode of the Aesthetic Edge. I am your host, Tracy, with TIG Advertising. Today I'm being joined by Ardis Schmitt, a nurse and owner of Revive Medical Spa. Welcome, Ardis. Thank you for joining me.
Thank you so much for having me today. I appreciate it.
Great. So, do you want to start off, Ardis, by telling us a little bit about yourself and Revive Medical Spa and what it is that you guys do there?
Sure. Thank you. I am the owner of Revive Medical Spa. We
Mhm.
are a large medical spa in Farmington Hills, Michigan, and we provide aesthetics as well as energy-based devices, lasers. We provide body sculpting and also some wellness, vitamin IVs, and some weight loss, weight management products as well.
Great. That's great. So you have a wide breadth of treatment options that are available. That's awesome. Oftentimes, we'll run into owners who like to focus in on one specific type of treatment. So it's good that you are a one-stop shop, as it were, for wellness and medical spa needs. That's awesome. So along those lines, what inspired you to establish Revive Medical Spa? You've been open since 2017, right? So
Correct.
yeah.
So, I actually have a little bit of an interesting past. I was a nurse for many years, and then I was recruited to go into technology to implement the first medical record system electronically in Michigan. And I moved out of the clinical side to provide that, and then a company bought us out, and I found myself in the tech world,
Okay.
and I was there for about 15 years. I ended that career at GE Capital worldwide as director of treasury technology. That company was folding, closing up. Due to the 2008 issues with housing. And then they offered me a chance to go get any training and gave me a nice golden parachute to stay for about 2 years with them while that happened. And so that afforded me the opportunity to go back into healthcare. And I determined that my passion had always been in medicine aesthetics. So I went and got a very significant amount of training and understanding of the business of medical spas. And when I finished that and finished the wind down of GE Capital, I opened up my medical aesthetic spa. I had a great business acumen at that point and a project and program manager and certification. So I had a good, solid business foundation, and I had an excellent clinical foundation as well. So those two things just led me to something I always had a passion for, and that's where the road in life led me to. So
That's quite the journey. That really is. It's amazing. The
yeah,
twists and turns there. That was. Thank you for that.
yeah.
Uh,
I always say you never know in your career
mhm.
what experience you're going to have that's going to be applicable in the future to something else you might do. So, everything is good to learn.
Good, very good. That's a great mindset. I follow that mantra myself.
Good.
Great minds, I say, right? So that's awesome. So Revive emphasizes a boutique state-of-the-art experience, right? How does that setting enhance the overall clientele journey?
So every single client that comes through our door, our staff is trained and myself to give them the Ritz-Carlton experience, very customized for each person. I think about all the senses, touch, sight, smell, sound, and make sure if it's chilly, they're getting a nice warm blanket out of the blanket warmer. They're getting some beautiful music, beautiful aroma in the clinic, and a real personal experience for each person where we really spend the time to assess and understand their goals and then create a journey for them. and lots of hugs.
Yeah. Yeah.
Yeah, and lots of love from the staff as well for our clients. We adore them. We have the best clients in the world.
That's great. That's great. That personal touch on every level goes a long way in building those interpersonal relationships. Um, I imagine you're influenced a lot from your nursing background in that experience, not only with your business acumen, but also just that care that comes from being a nurse and then transitioning that into the aesthetic space is so impactful for the customer and for the client and for the patient and on so many levels. And that just what I have found builds an inherent trust, not only between the patient and you, but also you and the patient, right? It kind of goes both ways there. And that is refreshing, right? To see that. A lot of places will be like one and done with their clients. And that doesn't seem like that's what you guys do. You guys are all about the long-term personal relationship that comes.
Absolutely. We've had our clients, many of them for over 7.5, 8 years now. Most of our growth is through referrals from our clients who
Great,
refer others into the practice. Probably about 80% is that alone. And and that's because there's a trust and a comfort with feeling that, and the truth is we do care. So I'm a big giver in life. I give a lot to a lot. And I love to give to my patients. One of my favorite things about what I do is that when I treat a patient who has some concerns that they want to address, and at their outcome they're no longer putting their head down trying to hide that scar or that deformity or that thing that they just didn't like about their face or their body. They're walking out with a bounce in their step and a smile and their head held high. That's when I know I've done my job.
great. That's awesome. That's really inspiring. It really is. So kudos to you guys at Revive and you artists for just setting that up in such a way. That's amazing. Really is. So uh moving on here, you're recognized as an expert master injector with Allergan. Uh there's not a lot of you in the world. So that's a big deal. Um how has that designation impacted the services you provide to your customers?
So, yeah, I to be honest, those are great things to have. But, for me, I really am so focused on my individual client and making their outcome as optimal as it can possibly be, that that's what I focus on every single day. And the rest takes care of itself, quite honestly. The people, the money, all that takes care of itself as long as I'm doing the best possible work I can do. And I've been told I do a really nice set of procedures for people. They're almost always happy when they get out of the chair and look in the mirror. They say, "Wow." So that's what I always look for.
Okay. Okay, great. No, that's great. So along those lines, um, how do you go about customizing the journey for each customer? Because you guys offer a breadth of treatments.
We do.
What does the journey look like, right?
Yeah. So one of the things that this is true. We offer a lot of different. I try to focus in on specific business lines. I try not to get too far out there with things that don't really marry with what we do. But in every room, we actually have a flat screen that runs through every single procedure we do because there's no way I can possibly suggest them all to a client. So it just gives them some information about what's available and, things they might be interested in. Then we also, at our first consultation, ask them their interests and if they have anything special coming up and, what brought them to us. And then we do a set of baseline photos on every single client Then they come into my room and I do a full consultation, um, from the forehead down to the toes, and we discuss any concerns they have. My first question always is, what do you like about your face? Because I want to know that they're happy with some things as well, and they should be, right? And then we go down and talk about the different issues they may, have, or things. I ask guys, does this concern you? Does this bother you? And then from there, they, identify for me their top concerns. And I may suggest a few other things that I see, and we'll create a care plan for them. That is a journey. It's not a one and done. I try to break those into visits and have them start, let's say, let's start with your cheeks. Your cheeks are very flat. Let's get them a little volume back that you've lost. And then at our next visit, let's talk about your lips that we identified are starting to invert, and let's evert those and make those back to the way they were when you were in your 40s. And you know, we go through a whole process and a plan and give them all the pricing up front. And then they can pick and choose, but there is an order to what I do. I usually try to go top down because every time I do something here, it's going to lift here and here. So they may need less. And I explain that to them. Same thing with body sculpting and weight loss and things like that. We have those discussions based on their interests. And then we create a care plan for them that we check in on and follow along the way.
Okay. Okay, great. So with that care plan and that individuality that comes with each client's treatment types, how are you staying in the forefront of the latest technologies and the latest treatments?
Yeah,
Go to
good
the
question. Yeah.
show.
So some of the things I've learned along the way, in terms of technology, almost every 2 or 3 months, there's a new technology.
Yes, yeah.
Not all of them work. Not
Mhm,
all of them are the best of the best. So, for example, I try to, pace myself and sit back a bit and see how it goes.
mhm,
Body sculpting. I didn't jump in on day one. Everybody wanted to sell me something for body sculpting. When I had about 5 different vendors that had different body sculpting device, I spent a summer evaluating all of them.
mhm,
And when something comes out, I evaluate it on myself and my staff first. I want to know that it's efficacious, that the outcomes are going to be good and they're going to be measurable, and that my clients are going to be happy. Otherwise, I don't want to invest my money. And I don't want my clients to invest their money on something that I can't stand behind and know for certain works, right?
mhm.
So I evaluated those over the summer. I had a spreadsheet. I measured all the things I needed to. And then I came down to something interesting. That's just one where I realized that, oh, well, all these devices are muscle stimulators and they build your muscle. But as soon as you get off the machine, you're going to atrophy and go right back where you were before. My clients would be really mad at that. However, Cool Sculpting was the one device that had massive impact on people and was permanent. So once that fat's dissolved, it's dissolved forever. It never comes back. And I've been doing the Cool Sculpting Elite, the new one, for 3 years now, and I have never had an unhappy client. They are always amazed. The afters are incredible on these, and it's permanent unless they want to eat a lot and gain weight again. That can happen, but those fat cells that are killed in that are gone forever. So it's a much, much better spend for the outcome, right? So
Okay.
that's the kind of thing I will do with any new device or new modality that comes out, is I will spend the time to understand it, make sure it's FDA approved, make sure it really does get the outcomes that we want it to. I'm in a group of injectors who do some research, and I also leverage their information. And I'm also in a group of owners who, 1,000, and
Okay.
med spa owners who will basically give the good and the bad and the ugly about the different vendors and devices and what they're seeing with it. So I have a lot of information to tap into to decide if this is the right time for me to take that on or if that's something I'm not going to take on.
Right. Right. That's great. You do a lot of homework, right? And you're very responsible with the information that you have and you provide. So that's I think that's really key to success, right? You only want to offer to your clients the things that are actually going to work as intended.
Expensive. People shouldn't have to spend money on something that's not going to get them their outcome.
Right. Right. No, that's absolutely true. That is so true. I gotta say, artist, this brief conversation that we've had so far has been refreshing in so many ways.
Oh,
Uh,
thank you.
no, that's awesome. Yeah, it's a lot of people will just, especially not especially, but a lot of businesses will go in just to make a quick buck, and that doesn't seem like what you guys are all about, right? You guys are all
No,
about the
right.
the
And a
long,
lot of med spas do that too. They're, focused on the money. Can I shove 3 more syringes of filler into a face?
right,
And then they come to me and say, "Help, I need to get this out," because I look like a chipmunk now.
right,
So, yeah, I always say my name is on that person's face, my name is on that person's body. They're my walking ad to
right.
everybody else they see. And I'm very aware of that, and I wanna make sure and I'll tell patients no. They'll say,
Mhm.
"I want more lip filler," and I'll say, "Nope. You have enough. And if you do any more, you're going to look like a cartoon character. So we're going to wait and we're going to wait till this dissolves in about a year and then we'll do it again. And if you want to go somewhere else, you can. But I'm saying to you, your face is beautiful and balanced right now. And
Mhm.
more isn't more.
Right, right. That's that's such a great outlook. It really is. I can't tell you how many people I run into in Southern California that are just overdone
Yeah.
in a lot of ways, and so and I respect that about what you do. That's awesome.
Yeah.
Yeah. So how do you incorporate more of the wellness type treatments related to customers? We've talked about injectables and fillers and cool sculpting, but what about the wellness treatments that come along, the things like PRP or the
Yeah. So we've been doing PRP for 7 years.
Mhm.
So that's been a part of our um, offerings for a very long time, very familiar with it, does a great job. We do hair restoration with it, as
Okay.
well as PRP and tear troughs. I'd love to do that to get those hollows out. I like that much more than I like filler. It's
Mhm.
natural, it does a nice job, and it doesn't some of the people who do the filler and the tear troughs tend to have results over 6 months a year where the filler starts to come to the surface and make bumps and bulges and things like that. It has to be dissolved. So I've always done the PRP in the tear troughs. It thickens up the tissue. It washes away the dark heme or blood stains inside, and it's a beautiful job. So I like that. So we've been doing PRP for a long time. I do IV vitamin therapy. I've done that for 7.5 years, and vitamin shots. I also have what I love is so newer technology is red light therapy. Amazing. It is incredible. It's not just to regenerate the face, it is for pain, aches, inflammation, anywhere. A quick story, I was at a 2 years ago, I was at a conference and they were selling the red light therapy device. And here I am, show me. Okay, I said, I have the shoulder that hurts. Show me that it works. The girl used this device for 10 minutes and a pain that I had for 2 years where I couldn't lift my arm like this was completely gone. And I'm
Wow.
like, okay, I'm going to spend 10 grand and buy these devices because they worked really well. And The one I got also has a blue light therapy on it for P. acnes bacteria, which is one of the causes of the acne breakouts. And I use that on one of my clients' daughters, and she just had terrible teenage acne, and
Hmm.
she is clear. She comes once every 2 weeks and gets another blue light therapy, and it's gone. So those types of things are great. Now, there's a couple other things I looked into, such as cold plunge.
Yeah.
And I do have an infrared sauna, by the way. So, one of the things I want to say to anybody listening is pay attention to, if you want to buy a red light therapy, even for home use, pay attention to make sure it has both red light and near red infrared light. You
Hmm.
need both those things to affect change, not just LED lights. So make sure you're getting something that has both in it and it'll be effective. And so we have the infrared sauna as well, which is great for inflammation and overall health. There's a lot published on that. Quick story, I was watching the NFL quarterback. They had like four quarterbacks on Netflix that they were following,
Hmm.
and one of the things they do, and this just to tell you, they put them under a full body red light therapy every week to reduce their inflammation because it works.
Yeah. Yeah.
So those are some great things. I didn't do the cold plunge because I just felt like, ooh, that's a lot of water in my med spa. So I've kind of passed on that one. And
Yeah.
then the other one I don't offer is the hyperbaric oxygen chamber because
Mhm.
it's actually dangerous. It's not a little thing. We actually had somebody in Michigan, they had one of their children in it, and they left them and they burned up and died for whatever sparked inside. Yeah, and this was just like about 3 or 4 months ago. So I would say for somebody wanting to do hyperbaric, get into a hospital to do it. Don't just go to some spa and get hyperbaric treatment. It can be dangerous. So that's one unless would have somebody sit there the entire time with that person, right? And that's not what's happening. They're putting them in and walking away. So, yeah. So those two things I haven't gone forward with. I feel like the cold plunge, I think that could cause heart attacks and things like that because it's a lot. So those two I haven't done, but most of the other regenerative things we're already into.
I think we hit on some theories around functional medicine with the discussion, right? So, do you find yourself doing a lot of functional medicine treatments for your patients?
I would say not a lot,
Okay.
other than what I've mentioned. I am now evaluating a device that is actually sound waves that
Okay.
is supposed to regenerate joints and things like that,
Mhm.
and and remove pain. Um,
Okay.
and actually cause people to not have surgery. So I'm looking at a couple of devices out there that I think are very interesting in that way. I don't do any hormone therapy. It's just something I didn't want to get into. I feel like you really need to do a lot of testing with that to make sure levels are right. And it's a lot that I just wasn't interested in, quite honestly.
No, that makes sense. That makes sense. Not every treatment is right for every practice, which I
No.
totally understand. It's funny you bring up the cold plunging and the red light therapy and other functional medicine items. I had recently talked with a an owner. Her whole business model is on red light therapy and different light spectrums, and she from the mountaintops just screams the successes that it can do for a lot of people.
Yes.
Um, which is really great. So now that I've had more than two people tell me its benefits, I may have to make my way to a red light therapy practice.
Or maybe you'll buy yourself a infrared sauna to put out in the back.
Yeah, yeah. No,
Yes. Yeah.
that is an idea. I don't
Yeah.
know how much my wife will agree with that idea, but that is a
Oh,
good idea.
she might love it.
That's true. That's a good point. So. You talked a little bit of a couple of customer successes, right? Really kind of things that you've seen great transformations on. Are there other memorable client transformations that you wanna touch on at all today?
So, I like scar reduction a lot. I love to help people reduce their scarring. Had a client who had bariatric surgery and needed a repair, and they went in through her back, and they had a scar this wide
Oh, wow.
all across her back and
Yeah.
very red, and it was massive. And actually, I was just talking to one of my associates and telling her I wanted to get the before and afters out. Well, after treating her over the last couple of years, her scar is about that big across her back. So we were able to use, I have something called subnovi plasma device, which sublimates the tissue and shrinks and shrinks and shrinks. And then we used a CO2 laser as well on her and some radio frequency microneedling. And that scar is a teeny little half inch across her back now. And it's white. So it's almost not even detectable. And I think that's just one of those amazing things if you have the ability to do it and you can get after it, right? You can really make a change. And I made a huge change in their life.
That's really amazing. How have you seen your services and your client base grow since you guys opened in 2017? What got you to that point where you were voted top medical spa in your area? Like, you have a lot of awards and a lot of interest around you. How did you guys go about accomplishing that?
The answer is really this. Well, we keep our head down. We work really hard at what we do. We make sure we have the best possible outcomes, and our clients feel very special every single day. And when you do that, you will grow, the money will follow, the awards will follow, the recognition will follow. And again, I try very hard not to focus on any of that. I try to focus on every day going in. And I have a big, in our lab, I have a big painting for the girls to look at. Work hard, do good. And that's what we do.
You were so articulate in answering that question. I thought was a bit complicated. That was wonderful, artist. Like,
Thank you. You're so complimentary. I appreciate you.
yeah, no, absolutely. So, okay, cool. So, what is in the future for Revive? Do you have any plans coming up that you would like to share to let people know about?
Just, I'm doing some assessment on this pain management. Not going to jump in right away. I want to make sure that they can prove to me it works and works consistently for people. I think that's a what I call a new business area. Uh,
Uh-huh.
so each time I do something like this, it's a lot. It's not a little thing. If I'm going to start into lasers for hair removal, that's something that's a business line in itself. And I have to press on that, advertise it, talk about it, market it, all those things to get it to grow. And then once it's in a steady state, I can think about something else. And that's how we've basically grown all along. So now I'm looking at the pain management. I would say noodling on it, studying it, making people bring the devices in and letting us try them with some of my clients who have pain. I wouldn't really go this route except for so many times I've had patients in my chair to get their Botox, and their whole discussion is around the pain in their knee, the pain in their shoulder. I might have to have surgery. And once they get in the chair and they start telling me these things, it seems to be very frequently. And I think if I could solve this in a way that let them avoid having surgery, that would be amazing, right? That would just be amazing for them. So I am looking at a couple of different products that potentially might do this for my patients. So then if I do go down this road, obviously it's investment and there's a business line that has to be formed. There's marketing, there's promotion. I have to look at what feeders will feed this business and this investment in order to determine if it's the right thing for us and if we have the right client base to support it. That's the business side of me.
Like that. So okay. Well, I gotta say, artist, this has been a great conversation with you.
And with you as well, Tracy.
Thank you. How can people find you? Your website is revivema.com,
Right.
right?
Revive, REVIVEMA, as in medical aesthetics, revivema.com. And honestly, if you go to the website, that's the easiest way. You can call us from there. You can book a consultation from there. You can read about all the services, the facts about them, and decide if it's something that's right for you. And you can learn more about us. And that's probably the best way to get a hold of us and to get the information to start to decide about, you know, personal journeys.
Great. Great. Okay. Well, this has been the Aesthetic Edge with Tracy at TIG Advertising. Thank you for hanging out with me today, artists. Everyone have a
Thank you
great
for
day. I'll see
having
you in
me.
the next episode.
Yeah.